trade. This is a video simulation on transfer of intra-hospital transfer of critically ill patient. So first we will prepare on the equipment. We have to ensure that we have a ventilator that has a full battery charge and the settings of the ventilator as per the patient's condition. We need to have an oxygen tank with the pressure gauge showing full oxygen. HME filter, bag valve mask that is properly functioning, and we're going to transport all these equipments in our transportation box in SAS. In our transportation box, we also have our syringes, cannula, securing tube. We have OPA and an extra endotracheal tube. Not to forget our drugs, which is adrenaline, and we will also bring as per need of the patient, such as rocuronium or midazolam. Next, we'll follow through with the circulation. So we need to bring some fluids, monitoring of the patients, as well as suction device if it's necessary. Next, on the assessment of intra-hospital transfer of critically ill patient, we need to assess on the patient's status. We start with the airway and breathing. Check if the ETT is secured, the ETT position, as well as the cuff pressure, if there's any leak. Next, we will check on the capnography waveform, if the waveform is present. And we will also review the arterial blood gas prior to transporting the patient.
Good oxygenation according to ALDS guidelines.
We will also examine the patient's chest wall. If the chest expansion is equal, auscultate for air entry, and correlate the PaCO2 with the EtCO2 of the patient. Moving on to the circulation, check the vital signs. If the patient is hemodynamically stable for transfer, all the peripheral cannulations is secured and functioning. Check for the disability. GCS, ensure patient is properly sedated and the pupils is reactive. Observe the ventilator. Ensure that the setting is correct. Observe the waveform, there's no leak or any ventilator asynchrony. Once everything is checked, patient is safe for transfer.
Okay, prepare.
Throughout the transfer, ensure that the treating doctor is monitoring the patient's vital signs as well as the ventilator waveform alarms. And once we have arrived in our ward or ICU, we would transfer the patient and pass over to the treating doctor of the receiving team. Once arrived in the ICU, the accompanying doctor will now pass over to the ICU doctor.
Yeah. Hi, Dr. James. Hey, I'm Tay.
Okay.